A tax on California health plans could take effect next year, and critics are warning that it could drive up insurance premiums. As always, thank you so much for joining us on To the Point. I'm Alex Bell. Tonight, a group of California Congress members is urging the Trump administration to block that tax. ABC's 10's Gina Nguyen joins us to explain what they are demanding and also how California's healthcare industry is responding.
Well, Alex, California's new budget restructures a tax on health plans. Critics warn the cost could be passed to customers through higher premiums. Now, Congress members are urging the Trump administration to block it.
That is responsible budgeting. This is part of it. I respectfully ask for an aye vote.
In June, Democratic leaders and Governor Gavin Newsom approved the state's budget, which included two proposed taxes. The Managed Care Organization, or MCO tax, is one of them and has been in place for about 2 decades. It's a tax on Medi-Cal and commercial health plans. California has historically charged Medi-Cal plans more, as those funds were matched nearly 1-to-1 by the federal government. But under new federal rules, the tax rate must be equal for private and public insurers, which is why the governor and legislature included the proposal in the budget.
My colleagues and I, signed on to a letter saying, don't give it, because that's the last thing that we need is to have, our insurance premiums go up even more.
Republican Congressman James Gallagher, along with independent Congressman Kevin Kiley, signed this letter asking the Department of Health and Human Services to federally deny the proposed tax.
What they're doing is they're imposing this new tax on healthcare plans. So it's about $8.50 per enrollee. And so what that means is that these costs are then going to be passed on to policyholders in the form of increased premiums.
The tax does not directly increase premiums, but the Nonpartisan Legislative Analyst's Office estimates premiums could rise about 1.5% if health plans pass the full cost to customers. Multiple healthcare groups also oppose the tax, including the California Association of Health Plans. Even though this is not a direct tax on residents, they argue this tax would add more financial burden onto people who buy healthcare coverage on their own or receive it through their employers. State Democratic lawmakers argued the new tax is needed given the unstable revenue.
We cannot live just on day-to-day stock market gains by the AI companies. We have to have a stable tax system in this state.
A spokesperson with the California Department of Finance tells ABC 10 this MCO tax was approved to comply with federal law changes that the president signed last year and anticipates the administration will approve this state proposal. Now, I did reach out to the Department of Health and Human Services for comment on this letter and have not received a response, Alex.